Good morning on this chilly Wangaratta morning. My name is Roxanne and I'm one of the podiatrists here at the Foot Centre, and I just wanted to take a little bit of time to talk about one of my favourite services in the clinic, which is Swift microwave therapy. Now, Swift microwave therapy is used to treat warts. Now, warts are a pretty common condition that we see here at the clinic, but they can be very frustrating for patients and for clinicians to treat because they're so patient dependent, and they can hang around for years. So warts are really good at cloaking themselves from the immune system, which means that the immune system doesn't recognize they're there, so they don't actually treat them. So what we need to do is get the immune system to recognize that they're there and start treating them. So this is where Swift comes in. It actually uses this little handpiece here, placed on the wart area, treating it with microwaves to heat up the area to allow the body to recognize something's going on there. Now, when I say heat up the area, you might think it's really painful. Now, this can be a little bit painful, but it depends on your own pain threshold. We can start really low and then move up, so it's really patient dependent. I've been treating patients with this for about 9 months now. It's a relatively new treatment, but I've had so much success. I've used it on 3-year-olds, I've used it on 70-year-olds, and it's been really safe and really effective for me. Because it does use the body's own immune system, sometimes we do have to boost the immune system before we start treating. So we can go through that with you. It depends, if you're a young child who's always getting sick, or if you're someone who has a chronic illness, like diabetes, it can sometimes affect the immune system. So we go through that with you as well. It's non-invasive, so you're not getting anything scraped off or anything like that. You're also not having to come in every week for treatment. You're not having to keep the warts covered. Like I said, it's been one of my favorite treatments, and it's really changed the way I practice. When someone does come in with a wart, this is the first thing I offer because I know it really works. So if you've had warts and you've tried a few things and it hasn't worked, or if you've had warts and you've tried everything and it hasn't worked, come in and try Swift. It works.